Might be kind of a fun video to make, just kind of like 5 major things that are frustrating, annoying, whatever you want to call it, in the first week or two of rehab. Might be kind of a fun video to make, just kind of like 5 major things that are frustrating, annoying, whatever you want to call it, in the first week or two of rehab. I'm currently just a week out from surgery, still in the brace, still I'm weight bearing as tolerated, but I would say I'm partial weight bearing right now. I still need my crutches in order to walk comfortably. But just to kind of share with you 5 of the big things, especially for those of you who have never had an ACL tear before, but do work with patients. I do think it'll help you kind of understand and be a little more empathetic at just understanding some of the frustrations that your patients might be feeling. So this is in no particular order, just kind of sharing 5 or 6 of the major frustrations that we have as people recovering from ACL surgery. I'm going to start with the first one. Is one of the big ones is sleeping. A lot of surgeons' protocols are a little bit different in regards to how long they have to wear the brace for. But I would say for at least, usually 3 or 4 days, you have to sleep with the brace on, and just having this big giant plastic thing wrapped around your leg, banging into the other leg, whether you move a lot. And also after surgery, you're not going to have your full range of motion. And this brace is constantly trying to pull you into extension, which is one of the goals, is so that you can't flex your knee. And it's just really uncomfortable having these straps pull down into extension while you're trying to, enjoy your sleep, it's really uncomfortable. I found myself waking up, every 3 or 4 hours, just due to either pain that I had from post-surgery, or just from discomfort from the brace of not being able to find a comfortable sleeping position. Number 2 is trying to put on clothes. It is extremely humbling I'm 33 right now, but having to ask my wife to help me put on clothes, because I can't bear any weight without my brace on. When you put on clothes, obviously I'm not going to be able to wear my brace. So just changing, obviously I'm talking about lower extremity, but putting on my socks, you're lacking range of motion. So trying to, get enough range of motion to put on a sock is really challenging. Also, and don't get me started on trying to put on underwear or shorts, same thing. You get on, it's easy to stand on your non-operated side to get the ACL sleeve side on. But then when you talk about the other side, you have to kind of like, either you're just laying down on the bed and then try to slide it on the other way, usually, or just like, I kind of found myself awkwardly tilting on and then just to have my wife put on the other side. But that's also just extremely frustrating because, again, you're just used to doing things by yourself. And for a little while, and for me, it's going to be 4 weeks because I can't bear weight without my brace on for 4 weeks. So I'm going to need help with doing that for a while. You can also do stuff by just trying to get on your bed. But obviously, again, if you have limited range of motion, it's really hard to get enough knee flexion to get into your shorts or put on your socks, and even shoes. Because I can't put too much force in my foot with my knee flexed, I haven't been able to put on a normal shoe, which is why I'm currently still wearing sliders right now, or sandals right now. Showering is extremely difficult as well. So the way that I've currently done it is go into the bathroom. We have a stool currently in the bathroom. My wife installed like one of those like hoses, that whatever you want to call it, those hoses that you connect, just so I can still shower myself. So I have to like sit on the edge of the tub and then kind of prop myself up and then get myself onto the stool while she's kind of holding onto my operated side, and then kind of slowly bring that into the tub. And then you can sit there and shower, everything like that. That part's usually fine. The actual showering portion is actually fine. And then on top of that, after you finish showering, the bigger portion is getting out of the shower. So for me, my wife, she'll hand me my towel. I'll try to dry myself off, particularly my feet, to make sure I don't slip. And again, she's holding on my leg, trying to prop myself up again, trying to get to the ledge of the tub, and then pivoting around, drying the rest of my body again, making sure my feet are dry enough to stand comfortably. And again, the whole issue with trying to put on the pant leg of the non-operated side without bearing weights on your ACL side can be challenging, particularly when you're cold, you're trying to dry off, trying to put on your clothes, all that kind of stuff. It is challenging. So that's, the point 3 is related to point 2. Number 4, stairs is extremely challenging as well. There's proper ways that they teach you how to do it, and it's funny because I know how the proper way of teaching people how to do that, but when you're 2 or 3, 4 days post-op, you're in extreme pain, and any quick little jostling motion of your leg is extremely painful. So as maybe unorthodox as it may be, I found going upstairs, I actually did more like a butt scooch, where I sat down facing downward to the stairs, and then I'll put my foot on I'll put my right foot on the stair that's right below me, and do almost like a tricep push, and then one step at a time. Tricep push, one step at a time, while my wife is holding onto my leg. I tried to do it by myself, but just again, with the subtle motion of my left leg kind of banging into the next step was very uncomfortable. So I just found her holding it was a lot more comfortable. Going down, you're just doing the opposite, right? So you're scooting down, kind of putting your foot down, maybe 2 steps down, and then scoot down 1 step, and then bring your foot down 1 step, and then scoot your butt down, 1 step at a time. I found that to be a lot more comfortable for me personally, at least for the first, honestly, 4 to 5 days. After my pain started subsiding, then I was able to use the crutches and use the railing to go up and down much more comfortably. But at least for the first 2 to 3 days, obviously they go upstairs to go to sleep, and coming back downstairs to spend the day on the couch, it was extremely challenging. And even then, I would say point number 5 is honestly just basic ADLs. It is, again, humbling to just be like, hey, can you grab me a cup of water? Because I can't hold my crutches and hold onto a cup of water or coffee, things like that. You obviously don't want to spill anything. So having the need to just ask for help is it's a little bit humbling. But that's where, having loved ones that are around you is super important. So making sure that they have a support group around them is extremely helpful for just getting around the house and just doing, very, very, again, basic things that you may not think that are that big of a deal. I would say those are some of the 5 major things that I found are frustrating for the first week. I'm a week in. Things are getting a lot better. I can at least hold something in my hand, just because I can tolerate a little more weight on my left side. But still, with the stairs, I can get up and down stairs a little more normally. I don't do the butt scooting thing, but I'm still going up one at a time, very slow, grabbing onto the railing. Showering, I'm gonna need help with for at least another month. Changing, at least another 3 weeks, because it's 4 weeks total. And then with changing, I'm definitely gonna need help as well. Sleeping should get better because I can get out of this brace tonight, which I'm very thankful of. But yeah, again, those are some of the 5 major things that I found very frustrating for the first week of rehab. And hopefully, again, just for you guys who are working with ACLs, you guys can just understand what we're going through a little more. And for those of you who have gone through it, I'm sure you can agree with these 5 major points. And if you have others that you want to share, please feel free to post them in the comments below. Again, I am genuinely appreciative of you guys who have followed me along. And I hope that you guys find this video helpful. I'm going to continue to do my best to document my journey. It's fun for me just to see my progress. I'm 1 week in, my range of motion, all that kind of stuff is improving. So I'm looking forward to sharing the rest of my journey with you guys. Thank you for watching. Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sports-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.